Hi everybody, I'm Butch Stearns here at HealthIT 2012 with Gary Hanna from Vocantas. Hey Gary, how are you?
Unbelievable.
Unbelievable?
Absolutely.
No one's better than you right now then.
There you go.
Pretty interesting 2 days here at the Harvard Club, isn't it?
Sure is.
What'd you get out of it that maybe reinforced some things that you were thinking about, or was an eye-opener for you?
I guess a couple things, Butch. First, the collaboration that really goes on in healthcare. It's one of those interesting industries that nobody really has the answer. Lots of interesting ideas. How do you get the things to market? Clearly there's a resource structure issues, there's costing issues. So I guess one of the things that's always good to hear at these things is you're not alone. You're not a lone wolf out there, which is good. A couple other things, that there's a lot of ideas that have been around for a long time, and a lot of new ideas, and then the collaboration, how do you bring those two together?
So time well spent for you.
Absolutely.
Talk about Vocantas and you talked a lot about it in the last 2 days, but for the people that don't know what you do, talk about what you do and what you're proud about, what you built with it.
Okay, well, a couple things what we do. Clearly what our claim to fame is the human behavior side. So we're a speech recognition IVR company. Dominantly doing two things, reaching out to people post-discharge, so following up once they've left a clinic or a hospital. And then probably what we've seen more in North America is reaching out and doing surveys, so helping with HCAHPS or patient satisfaction surveys to see.
And you say North America is your Canada-based company.
Absolutely.
Yeah, okay.
Yeah. Well, we have the best healthcare institutions in Canada. We'd like to share that with the Americans as well.
We'll get on that social healthcare eventually. So yeah, and what are you most proud of that you've produced or that you provide for solutions for your clients?
I guess that one of the key things is device-free. I mean, we talk a lot, particularly at this conference, of putting devices in the home and monitoring devices. What we can do with our technologies, once you've left, everybody has a phone, or at least most people have a phone, so you can interact with us really easily. You don't have to put anything new at the location of the patient. So one of the things we're most proud of is something that's ubiquitous. You can really reach out to everybody who's left the institution, the clinic. It's easy for them to use. And if you think about our aging population, it's great that you have web, it's great that you have BlackBerries, it's great that you have iPads, but if you've got shaky hands or you've got bad eyesight, you can't really interact. Everybody can talk on the phone.
Right, and talk about, so with voice recognition technology, with voice technology, and with healthcare, I mean, again, this was talked about a lot over the last 2 days, but it really is amazing to think about the opportunities from both the patient side, a doctor's physician side, and from a provider's side, the opportunities that can be created here.
Yeah, and that's really one of the key things you get on an event like this is the collaboration. We call it within the four walls and outside the four walls. Clearly we work outside the four walls, but you know what? You need the data of what's collected while you're in the facility, so when you leave the facility, we can follow up with you, and then putting it back into the physician's hands after the fact.
So final question, health IT professionals that weren't able to attend here, what type of advice do you give them on where to start to tackle their, they all have their common pain points about what they're doing. When you're talking to your clients, when you're talking to health IT professionals, where do you start that conversation, or what do you focus it on?
Great question. Look at some of the low-hanging fruit, because one of the things, if you really can look at applications like ours, if you take the resources you take to follow up on patients today in the chronic disease side, or just on clinical follow-up, is you can take our technology, redeploy that, free up those resources to do something else. So if one of your big crunches of somebody from an IT professional that wasn't here today, find the low-hanging fruit, save some money doing that by using technology like ours, take that resource, it's always under the crunch, and redeploy them. So start peeling away that onion and working on things. You got some big projects clearly on your radar screen. Maybe there's some little ones that can really help you out.
Great to meet you, and continued success with Vocantas.
Thank you.
All right, Gary Hanna from Vocantas. I'm Butch Stearns, part of our continuing coverage here of HealthIT 2012.